morning, Virginia and Jack. It's good to visit with you once again. I truly appreciate the opportunity to meet with you and discuss for your viewers the current status of coronavirus in Alabama, the River Region, and in Montgomery. It is sometimes difficult to discuss the current status of coronavirus because, as you know, the situation changes very frequently, almost daily in some circumstances. However, I think I can provide some general concepts for your viewers to appreciate what is actually going on and what steps that they can take personally to prevent themselves and their loved ones from acquiring coronavirus. Coronavirus is now in Alabama. It is very similar to other epidemics in the sense that the early cases occur in the large metropolitan centers in our nation, and then eventually move into the smaller, medium-sized metropolitan centers, and then eventually into the rural areas. And that's exactly what's happening now in Alabama. Alabama is one of approximately 26 states where there is actual increased transmission occurring on a daily basis. The concept that is used to determine how significant transmission is occurring is called R-naught, R-N-A-U-G-H-T. An R-naught of 1 indicates that one person who is infected with the disease can infect one other person with the disease. The most infectious disease that we are aware of is measles, where the R-naught is 12 to 14, which means that one person with measles can infect 12 to 14 other people with measles. The R-naught for coronavirus in the early stages of the pandemic was approximately 2.5 to 3.5. That has decreased slightly, but is still over 1.5 in Alabama, which means that one person who has coronavirus can infect at least 1.5 and perhaps 2 other individuals. When the R-naught approaches 1, and particularly when the R-naught goes below 1, then we know that the disease transmission is decreasing in any community, and we can see hopefully the end of the serious phase, the serious part of this pandemic. What many of your viewers are aware of is that the cases in Alabama are increasing, and in fact, 1/3 of the new cases in Alabama have occurred in the past 2 weeks. These cases are increase in number of cases is probably due to a number of factors. First, there is increased testing, which is good, but it's also important to note that there's increased cases because more individuals are having symptoms of coronavirus and then seeking a testing site. With the increased number of cases, unfortunately, we have seen a significant surge in the hospitals in the metropolitan Montgomery area, a significant surge in the number of patients in the hospital with a complication of coronavirus. That number has essentially tripled in the past 10 to 14 days. Many of these patients are in the intensive care unit. Many of these patients are on ventilators, breathing machines. I think it's important for your viewers to know that although we have seen a significant number of new cases in the hospital, a significant number of new patients in the intensive care unit, a significant number of new patients on ventilators, there is still an adequate supply in the Montgomery hospitals of both intensive care unit beds and ventilators, so that there should be no concern that if you have to be hospitalized for coronavirus, or for that matter, any other medical problem that you may have, then you will not necessarily have to be transferred outside of your community. You'll be able to receive your care here in Montgomery. We are very, very fortunate in Montgomery to have a superb group of physicians who are dedicated, wise, compassionate, and competent. Likewise, we have a similar number of nurses who are putting their own personal safety at risk to provide care for others. They've done this in the past. They will continue to do this in the future. We have respiratory therapists, phlebotomists, housekeeping, The list goes on and on and on of just wonderful people who are putting themselves at personal risk, again, to provide care for their fellow citizens. Okay, so what can we do about it? What can we do as an individual, you, me, everyone? What can we do about the coronavirus? First, I think, and foremost, is listen to reliable, accurate information. It is said that this coronavirus we're at war with the coronavirus. A very common phrase that I think many of you have heard is that the first casualty of war is the truth. So therefore, I would urge your viewers to listen to individuals who have expertise in infectious disease, expertise in public health, expertise in epidemiology. Dr. Tony Fauci, Dr. Deborah Birx from the NIH, Dr. Michael Osterholm at the University of Minnesota, our own Dr. Scott Harris with the Alabama Department of Public Health. These are individuals that you can count on to give you accurate, unbiased information. Please do not seek your medical information on social media sites. When individuals post information on social media sites, they are doing it perhaps with their own personal agenda. Likewise, the same can be said for the so-called pundits on talk radio and TV talk shows. These people are promoting their own concerns and not necessarily always providing accurate information to the public. Stay at home. If you don't have to go out, stay at home. Go to the grocery, go to the drugstore, go to a physician visit if you have to. Stay at home. There is no reason to start having social gatherings at this time. And unfortunately, particularly for those of us in Alabama who dearly love to go to church, it's not time to have in-person church services. There have been numerous small clusters linked to either church services, funerals, even a choir practice where one individual infected all the other members of the choir. So stay at home unless you absolutely must. Social distancing, at least 6 feet. That's the word, 6 feet. Further away is even better because it's known that this virus, if you have someone who has a very vigorous cough or a vigorous sneeze or a vigorous shout, it may be spread beyond that 6 feet. Wash your hands. Wash your hands. Wash your hands. Use hand sanitizer if you don't have access to hand washing. So keep your hands clean. And finally, this is the part that may be very controversial, but wear a mask. When you wear a mask, you are preventing others, friends, family, loved ones, other individuals in the community from acquiring the coronavirus. So if everybody wears a mask when we're in public, we'll cut down the transmission. You can make your own mask at home, you can order masks off the internet, but wear a mask in public. Unfortunately, I've seen in the times that I have been out, a lot of folks walking around without masks on. And that's just not good sense. Common sense sometimes is in short supply, and wearing a mask is a very easy thing to do to prevent the transmission and increased number of cases, hospitalizations, and tragically deaths. So that's the situation that I see the coronavirus today. Again, it may be different by next week, but keep informed, listen to reliable sources. And once again, Virginia and Jack, thank you so much for allowing me this opportunity to visit with you and to discuss this topic with your viewers. Best wishes, stay safe, and be very careful.